has recorded 1,038 cases of Mpox as of March 3, 2026, with 8 deaths. Addressing Parliament, the Health Minister Kwabena Mintah Akandoh says the disease had been reported in 124 districts across all regions. He says the Greater Accra region and Western region were the worst affected since the outbreak began in May 2025. Ni Ayikwe reports.
The Minister of Health, Kwabena Mintah Akandoh, appeared in Parliament on Monday to answer questions relating to the Health Ministry. He disclosed that 1,038 cases of monkeypox have been confirmed as at 3rd March 2026, with 8 deaths recorded. He outlined measures by the government to mitigate the impact of the disease.
Ghana has recorded 1,038 confirmed cases and 8 deaths, largely among persons with underlying health conditions. 124 districts across all regions, representing 47.51%, have reported confirmed cases, with the Greater Accra and Western regions being the most affected. There is currently 1 case on admission with no critical cases.
He stated that government is bearing the cost of medical bills of all patients of monkeypox disease.
Government has further ensured that medical bills relating to the patient care during this outbreak are covered by the states so that no cost is passed on to the affected persons.
The Minister of Health, Kwabena Mintah Akandoh, also disclosed that health facilities have been directed to use not less than 10% of their internally generated funds for maintenance purposes. Providing an update on a victim of the military recruitment exercise stampede that occurred at Elwak, the health minister stated that the government will not hesitate to offer her medical care abroad should the need arise.
Government is also considering all appropriate medical options, both locally and where necessary abroad, to ensure that she receives the best available care.
In an interaction with journalists, the Member of Parliament for Utusenya East, Phyllis Nakoyo, urged the government to increase funding for malaria vaccination amid cuts in global health funding.
The Minister of Finance should make provision for the Ministry of Health so that the vaccines that are expected in the country do not come down. Maybe initially, if you were getting about 200 boxes example of vaccines, it shouldn't go down to 100 or 50 because of the donor support system that had been cancelled.
Reports and for ChannelOne News from Parliament, I am Ni Ayikwe Okain.